So most of the time I usually hear people comparing between clinical medicine and nursing. Some people say that nursing is better, some people say that clinical medicine is better. But for me, what I usually tell guys is that choose a course because it is what you want to do, but not because this is what other people say is better than the other one. And today I'd like to compare the two, not on which one is greater, but so that you can be able to look at the two, so that when you want to choose a course, you can choose because you feel that that is what you want to do, and not that is what you feel like someone told you you should do. Hello beautiful people, welcome back to my channel. If you are new here, my name is Lois Odor, and today I'm not going to say I'm a final year nursing student because I was done with nursing school like 4 days ago. Yeah, so I still talk about nursing and also give health tips, and I'll continue giving more and more vlogs of nursing because I'll still be a nurse and I'll still continue making nursing videos. And so today I wanted to talk about how is it like being a nurse and being a clinical officer, because I've interacted with clinical officers too. So you know, most of the time I usually hear most students, especially those who want to join, they usually ask guys that what is the difference between clinical medicine and nursing, and which one should I choose. And most of the time, you'll find that those who do clinical medicine, they'll start telling them clinical medicine is the best, choose clinical medicine. And then those who do nursing will again start telling them, do nursing, nursing is the best, you'll get a job. But what people don't get is that every course is best on its own way. Like being a clinical officer is best in its own way, and there's someone who is passionate about that. And being nursing, it's special in its own way, and there's someone who is passionate about that. So if I tell you that nursing is the best, and you do nursing because I've told you that nursing is the best, then that means you're doing nursing because I told you, but it is not what you want to do. So most of the time when you want to do a course because that is what you want to do. Because most of the time, even if it's, let's say, medical laboratory or nutrition or whichever course it is, just make sure that this course is what you want to do, and you'll get a job in that course. Like, even let's say it's clinical medicine. Who said that if you can't get a job in the hospital, just sit at home? You can open your own clinic. You can do in private sectors. Like, there are so many things you can do. So don't just stay with the mind that only because people say, I don't know, nursing is marketable, so you want to do that course. Please, especially for nursing, I usually say don't do nursing because someone told you it's marketable, you're going to go get a job, you're going to go to the US. Do nursing because you have a passion for it. Because I usually hear some people say that they're doing nursing because they heard that for nursing you can be taken to the US and UK and you can get a job. I don't know, they had the government advertising that they're taking 30,000 nurses to the UK, and so you want to do nursing. As in, nursing is just not a joke whereby you can just try. Like, for nursing you really have to go for it. Like, you have the passion to go for it, or else you're not, like, let me just tell you the truth, you're not going to do nursing for a passion, just going to do it for a job. And that's why you have so many nurses who are like, they don't have the heart to work. Like, I've met so many nurses who are just doing nursing because they want to be paid a salary. So before you choose to do nursing over maybe clinical medicine or whichever course that you wanted to do, before you give up that course and choose to do nursing, first of all, just sit down and ask yourself, is nursing really the thing you want to do? Are you doing nursing because you heard that you will be paid a really good salary, or because you heard that it's marketable, or because you heard that you'll never miss a job, or because you heard that you'll be taken to the UK? Is that the reason as you're doing nursing? Because you are doing it for the very wrong reason. So for clinical medicine, let me tell you, for those who don't know like about clinical medicine, for me I usually take them like the doctors, because when you sit in the clinic or in the hospital, you find that the clinical officers are the ones who do the most work, because they are the ones who will clerk the patient. Like, when you get to the hospital, those people whom you call daktari, those are the clinical officers, because most of the time the doctors, the medical officers, most of them, they're not usually there, they're usually busy, so they'll only come when the thing is kind of critical. But most of the time, for the minor ailments, you find that the clinical officers are the ones who usually deal with it. So if you start asking yourself, like, what do clinical officers do? Like, they don't have a job, such kind of thing. Just know that, like, it's a really good course. Well, for me personally, I had to do clinical medicine first before I gave it up and started doing nursing. But it is a really good course. So if you want to do it, just know that, because some people usually say, I have never seen a clinical officer, just know that the person that you usually meet in the hospital, the one who usually asks you like what's wrong, Nini, the one who usually writes that, most of the time here in our country, it is usually a clinical officer. So don't underestimate them only because you hear daktari and you've never heard someone saying clinical officer. So they usually, like, even when it comes to like doing a higher diploma and advancing yourself, I have a lot of friends who have advanced. Like I have a friend who has advanced to major in psychiatric, and he's really a good psychiatrist, and he started from being a clinical officer, and now he even does like personal counseling and such kind of things. So if you are really passionate about being that kind of a person, don't give it up only because you heard that nursing is more marketable, or because you heard that maybe you don't understand. Just ask. If you don't understand a certain course, just ask instead of giving it up only because of things that people say about that course. And something else, people should just stop comparing like nursing and clinical medicine, because those are like two different things. It's like, it's so different. For me, it's usually just like comparing a doctor and a lawyer. Like they do totally different things. Like the clinical officer, they'll meet with the patient and do all the clerking and all the the things that the doctor does. But for the nurse, they have the hand-to-hand contact with the patient. Like they're like the patient's advocate, and they're there for the patients to give the medication, like patient care, So if you can't deal with the patient care stuff and you feel like you can deal with, I like to use the example of being a doctor so that people can really get it about clinical medicine, because people don't understand what clinical medicine is. You can always do that. So let people not discourage you. Like today I just wanted to encourage those people who want to do clinical medicine, but people are really discouraging them because they are saying that it is not a good course, that they should try and do something else like nursing. No. If you want to do clinical medicine, do it for what it is. Because for nursing, at times, the reason I usually say it's tough, because for nursing, there's a lot of pressure because we do most of the work in the hospital. And I found that some people can't handle that pressure. And there's a friend of mine who couldn't do nursing, and when he got into clinical medicine, he found it so easy for him. So just ask yourself, like, research about nursing and then research about clinical medicine. Find the difference between the two, the real difference, and see which one you can do, not on what people say. Because for me personally, if you ask me, I'll tell you nursing is the best. Why? Because that is what I've done, that is what I know, that is what I've experienced. So when you want to know like something, don't ask one person, don't ask me, then ask another person who has done clinical medicine, so that you can weigh out the differences. Like for me, there's a time that I wished I could have done clinical medicine, because at times for me, like nursing in Kenya used to be so kind of tough. Most of the time they usually say nursing is good because you'll never miss a job or something like that. But the bad thing is that is in other countries, but in Kenya nursing is kind of tough, because patient care in Kenya, like it is almost 20 to even 30 patients per one nurse, or even 10 patients per one nurse, and that is just so tiresome. So most of the time, if you hear people saying that, for clinical medicine, you don't have much work, but for nursing, there's a lot of jobs, you'll always get a job, you'll always, something funny, what people don't realize is that is in other countries whereby they require patient care to be 2 patients to 1 nurse, or even 1 patient to 1 nurse. But in Kenya, like, I think they don't like to hire nurses because they don't, is it that they don't like to pay people or something like that? Because I've never understood why we have 1 nurse or 2 nurses on duty and we have over 40 patients. So most of the time, if we say nursing is marketable and such kind of things, maybe you should just picture it for like doing it abroad. But in Kenya, like it is, yes, it is marketable, you'll get a job, but it is not so marketable because everyone wants to do it. That is something else. Like everyone wants to do nursing because they think it's a job. So everyone will leave clinical medicine and everyone will run to nursing. So that's why I'm telling you, at times it is better to use your own way. Like if you wanted to do that clinical, do it, because everyone is running towards nursing. And we'll be like so many of us, and we are trying to fit in a kind of care whereby in Kenya, I think we haven't reached to that point whereby we want to really, really hire nurses to work. So everyone is competing for that post. Like even over 40,000 nurses graduate almost every year. Like at times they don't even have places to go because it is becoming very competitive. Everyone wants to do nursing. So if you want to do clinical medicine, it's better for you because not everyone is competing to go there. I hope you are getting me. But whichever course that you want to do, let it not just be clinical medicine or nursing, or whichever course that you want to do, just make sure you consider that this is what you want to do from passion, not because people are comparing it. And people, you know, these people, everyone will tell you something. Like me, you can't come to me and expect me to tell you that I don't know medical laboratory is better than nursing, because I don't know about med lab. I've done nursing, and that is what I feel is better for me. So let's stop like confusing others, like the Form 4 leavers. We're trying to confuse them. We're trying to make them feel like nursing is the best course. Yes, it is. Yes, you'll get a job. Yes, as people say, oh, you'll go abroad or such kind of thing. But let me tell you, not everyone wants to go abroad. Some people just want to like find something for themselves, not just to go abroad. Like the way people take nursing, like you'll go abroad and such kind of things. And who told you that because you do nursing that it is absolutely sure that you'll go abroad? You'll even like the competition is high. You'll even miss that chance of going abroad if that is the reason as to you're getting into nursing. So just make sure you get into nursing for the right reasons. Make sure even if it's clinical medicine, you get there for the right reasons. So like I wasn't going to compare, I don't know which one is better than the other, but just to clarify to guys that do that course because that is what you really want to do. And thank you so much for watching this video, and see you on my next video. Bye bye.